Number one, I think that with chronic pain, I think that let me say my point of view, in my humble opinion. Okay,
Mm-hmm.
so I don't know every single physician in the world,
Mm-hmm.
obviously, but for the people who I've had the opportunity to work with and work for to help them get out of pain, of whether it's fibromyalgia pain or it's pain from they have MS or they have lupus or they have arthritis or they have whatever the back pain or they have headaches or whatever the symptoms. I'm not minimizing their concern or their symptom. I'm just saying whichever symptom or series of symptoms and whatever diagnosis label has been given to them regarding those symptoms, whatever they're suffering from, for the people who I've had the opportunity to work with and for my opinion of some of the interviews that I've seen on YouTube and other places that certain physicians of very big top neurologists or big top rheumatologists in hospitals or big universities when they're giving their opinions and their supposed insight to the condition, the reality is they're missing the the true causes of the disease. And so it was very interesting when I didn't really get this. I was trying to, with chiropractic many years ago, work with people with fibromyalgia. And I said, I've got a nice office. I'm a nice guy. I do good chiropractic work. They should just respond and get better. And they weren't getting better. They weren't getting better. So maybe they had a good day here and there, but it wasn't because of what I was doing for them. Uh, and and there was a video that I saw, I think it was called Under My Skin, where they talked about Lyme disease and how bugs got in the body
Mm.
and caused the disease, and when the person could recover by getting rid of the bugs, or decreasing the, let's say, amount of infection that was in the body, people had tremendous improvement and reduction in their pain and improvement in their health. And that video really helped me to start to see like there really is a way of helping a person get out of pain. And that's got to be the truth, the under, things under the skin, basically. So I think that these physicians are not. I don't remember your exact question, but I believe it's this point is that they're missing the causes, and there are
Mm.
people who can have high levels of heavy metals in their body, as well as they can be also living with, let's say, a chronic infection of, let's say, Epstein-Barr virus for however old they are. It could be 10, 20, 30, 40, 50 years of living with the virus in there. They can also have influenza virus and parainfluenza virus, and they can have mold and mold toxins and Lyme bugs and strep and staph and candida and other fungal infections and residues of antibiotics. And I can go on a long list of different pesticides and things that have gotten in. And even anesthesia chemicals from dental procedures that stay in brain and other parts of the body, and other anesthetics and sedatives that were used in other possibly a surgery or a colonoscopy. These different chemicals and these organisms that get into the body, they stay there, and these different disease causing agents, when they're there, they will continue to cause the breakdown of the body. And when a physician is looking at it, like, let's say a rheumatologist runs a blood panel on a patient and says, yep, you've got positive rheumatoid arthritis, and we see that you're not anemic, and your blood sugar is okay, so it's not diabetes, and your thyroid looks okay, and but you've got some high white blood cell count, and then they see, well, you do have an old Epstein-Barr virus, and you have an old, possibly old influenza, and but that's all that we can find. And we don't see anymore, so they put them on a steroid and they put them on an anti-inflammatory of some kind or an immunosuppressant, and that's it.
Mm.
And that's it. Or some of the doctors are going to say, go gluten-free or dairy-free. But even people that I realized when I was doing that, only doing that, or part of what I was doing years ago in the functional medicine arena, uh, there were some people who did have a dramatic reduction in symptoms, but there were some people who experienced, so they told me they were doing it, right? Living with a clean diet. They were not responding at all. They were not responding at all. So again, I believe that the thing that the physicians are missing about the chronic disease, whether it's chronic pain, is that they're missing how to find the truth in the person. They're missing how to find what it is. And when they don't do it, and they're running all these different laboratories, they're I'll tell you, there was a woman brought her daughter. Her daughter was 14 years old. She had terrible migraines every day. I don't remember how many years, but terrible migraines. She had chronic fatigue. She had brain fog. She had headaches also, because she arranged her head pain in two different ways. There was headaches and there were migraines. And when I looked at the blood laboratory that she had brought in from her records from another physician, I remember what doctor, rheumatologist or intern or general doctor, whoever ran the blood test on her, I saw all this high Epstein-Barr virus count in the blood. And I said, she's got that. I'm only referencing Epstein-Barr only for this patient right now, but I'm just not saying that everybody has that as their treatment. Okay, I'm just hypothetically bringing up certain points in people's, tissues that I'm studying to help get them better, but which it is pretty much a common infection, Epstein-Barr. But anyway, she had the doctor who saw her before me to try to give her relief from her chronic fatigue and her head pain or migraines. He said that it was an old, dormant, inactive infection. And so when I did my exam with her, I found that Epstein-Barr was tremendous, infecting the brain. It was in the spinal fluid. It was in the meninges around the brain. And when she took the remedies that we created for her to get rid of Epstein-Barr and a few other things that I found in her, she came back for the next visit. All the migraines were gone. And she had those migraines for years. So they can even, I think that doctors are even partially misinterpreting what they're reading in a laboratory. Does that answer the question? I'm sorry, because I went off on tangent there. I don't remember exactly the simple form of the question that you asked, but I think they're just missing it.
It does answer the question. I guess if I was to summarize your answer, they're not really looking for the root cause. They're looking for a diagnosis that they can medicate
And just have it where the insurance company possibly or the government approves of the treatment that they're going to provide, and they feel like they've done a good job, and they go home and they pat themselves on the back, and they can, just say they're doing the work that they were trained to do, basically.
And the other thing I was going to add from what you said was they're not looking at the body as a holistic system. They're just looking at it in very individualistic parts rather than looking at the body as a whole.
Yeah.
Awesome. So do you have any view on the Eastern philosophy that suggests that pain serves a purpose, or that the purpose is to inform us or teach us something? Do you have any views on that?
I don't know that point of view. I'll say that it is to teach us. There are two things. One is if somebody's got a chronic back pain or a chronic head pain or a chronic arm and hand pain, let's say, the body is giving us a sign that there's something that's invaded, whether it's a chemical and or an infection or multiple infections and chemicals that have gotten into parts of the brain or the body. And this is just a sign. It's like a check engine light that comes up on the car's dashboard that says something's wrong in the engine. It's a sign. Excuse me. It's a sign that something. Sorry about that. It's a sign that something is in the system of the body, wherever it is, whether it's the lymphatic system or it's in the brain. It's something is there that we have to find and get rid of. So then the pain goes away. The pain is a signal. Now, could the pain be linked to a past trauma, whether it's a head trauma, like a brain injury, or is it from a past trauma of an emotional trauma? So that emotional trauma, what I figured out, and on my website, I have an emotional page all about this type of exam process I figured out to do for people to help people overcome depression, anxiety, as to serious symptoms that a lot of people deal with. But I've also realized that a pain in the body, let's just say somebody has high blood pressure, for example, or chest pain or shortness of breath, and it can be linked to a previous trauma that maybe the child was molested the adult was molested as a child, or a wife's husband was cheating on her, and then she found out and it caused devastating, real emotional stress. And that, what epigenetics talks about is these different emotional traumas will trigger disease to be created in a disease state of the cell. And when we think of the human microbiome and the human virome, viruses and bacteria that are part of us and part of our genetic makeup, that these organisms that can be dormant, they can turn on and now begin to express themselves in a tissue in the heart, in the brain, in the thyroid, in the stomach, wherever in the body, and they now will make the person have that pain. So the pain sign is telling us something's wrong in an organ or something's wrong in some other part of the body. And it can be linked to an emotion because the emotional trauma triggered the cell's virus that's part of the cell. That virus is now activated. We have to find through the emotional situation and link it to that virus that's in, let's say, the heart And when we can link that, the person was molested and it triggered this virus that's on the heart, and now they have high blood pressure. And when we link that emotion, when the type of test that I figured out to do to link that emotion, that time in life, that experience to the virus that's on the heart, get rid of the virus from the heart, now the blood pressure goes down, and they've healed from that emotional trauma. So yes, emotional trauma, yes, there could be a physical trauma, but yes, you are right, is that, let's say the liver is showing that, the shoulder hurts, for example, and it's an infection in the liver. So I believe that these just to recap what I said, is that the different symptoms are signs of something is in the body that we have to figure out what to do for the person to heal and get rid of that signal, get rid of that sign, get rid of that symptom.